This event here in Parliament is a key part of CF Week. It gives us an opportunity to speak to MPs, to people making the decisions about the future of healthcare.
I've got a constituent who contacted me, and both of her sons have got CF, and it wasn't really a condition that I knew much about, but I looked into it, got in touch with the Trust, so now I'm delighted as an MP with constituents who are affected by the condition to actually host this reception here today.
The point we're making to MPs today is that is really the outrage of the fact that 1 in 3 people with CF on the transplant list are dying before they receive donated lungs. That's not acceptable, not least because we know that there are far more lungs donated than are used in transplantation.
MPs obviously receive a lot of invitations to attend similar events, but this kind of certainly attracted my attention in particular. It's a subject I've been interested in, and obviously very happy to support the campaign that you guys are embarking upon.
Thank you to all of you for coming along. Before we hear from our speakers, let's just watch a short video about the Cystic Fibrosis Trust.
Cystic fibrosis is why we're here.
It's a bugger. That's one thing it definitely is.
It's a condition that I have, but it doesn't have me.
I want you to imagine that slowly but surely, one by one, you have to watch your friends dying from the same thing that you know is going to kill you if you don't get a transplant in time. That is the reality of life on the transplant list. It's a life on pause.
The consultation that we're launching today is about getting that conversation going, getting as much input from everyone who's associated with this to try and make a real difference. We still have 40-odd% of families at the point of death who refuse the wishes of their loved one in letting those organs go. We really do need to drive up that debate.
I hope it's the start of thinking about the NHS in a different way. The MPs, clinicians, patient groups, doctors, nurses can all work together in a different way for the right reasons and deliver healthcare in a collaborative way.
And to all the politicians in the room, please also understand that there is a significant cost benefit. Not only are we not putting young adults in hospital extensively to treat them, and in fact we're turning them into, dare I say it, normal human beings.
We can make a difference. We can stop those 30% who aren't just a statistic, who are real people with real friends and real family. We can stop them dying.
I hope that MPs paid attention to what we were trying to say, and I hope that they've taken something away, that they understand that they can actually do something to make a difference.
This is something that is not going to go away. We recycle milk better than we do recycling organs at the moment. You know, there are some huge opportunities that we have here. Huge cost savings, huge quality of life changes that we can really deliver for patients. Let's not forget, 92% of people say they would accept a transplant. Let's have some equality here, let's have some equity, let's get 92% accepting that those organs should be donated.
When we speak with one voice, when people get together from our community with a very clear commitment to action and to change, we can make a difference.
One person in the reception today came up to me and said, I met you once at a talk you did before your transplant and I almost didn't recognise you. And I think there's no better description of just how life-changing a transplant can be. It's not just about saving lives, it's about changing them completely.